Everybody, and welcome to this webinar. We'll be starting in just a few moments as we wait for people to join. Hello and welcome to this webinar, the second webinar in the foster care series. It's good to see so many people here. I'm just letting you know that today's webinar will be conducted in English with simultaneous interpretation in Spanish. If you'd like to access the Spanish interpretation, you can follow the instructions that will come on the screen in just a moment. That's the instructions for the Spanish interpretation. So today's webinar is being recorded and it will be available in Spanish and English. And if you would like to join the Spanish interpretation, then the instructions are on the screen. Okay, so today's webinar is being hosted by the Transforming Children's Care Global Collaborative Platform. And this is a platform that's a community of actors and organisations that are engaged in child protection and care reform. The overall vision of the platform is to establish a more strategic sector-wide collaboration from the global to the local level by coming together and building on one another's work, in order to secure a greater and more sustainable impact, as well as undertaking joint advocacy. The platform is open to everyone, and there will be more information in the chat, as well as how to join if you're not a member already. As a member, there's lots to be involved with, and you'll receive regular updates. So moving on, I would just invite you to put your name in the chat and introduce yourselves. Perhaps your name and the organisation and where you're working would be great. That's great. If you want to select panelists and attendees in the chat, then everyone will be able to see it. See, some people will start to do that already, and that would be wonderful. And like I said, the webinar is being recorded and it will be available in Spanish and English. I'd also invite you to use the Q&A function on the bottom of your screen if you have any questions throughout the webinar. Not all the questions will be answered within the webinar. We'll try and answer some, but they will be used in future in the task force on foster care. I'll talk a little bit more about that in a moment. So my name is Louise Cox. I work for the Martin James Foundation, and I'm very happy to be here co-convening this webinar series and the task force group on foster care with my colleague Barbra Aber, who is the Regional Family Care Advisor for CRS. So about today's this spotlight series here on foster care. Today is the second of 5 webinars that are about different aspects of foster care practice, and they're going to be taking place once a month until August, and you can see the dates there on the slide. We had a really great introductory webinar last month where we heard from colleagues in South Africa and Uganda. One of the purposes of the webinars is to capture learning and experiences to inform a thematic brief paper on foster care. And after each webinar, we'll be convening the task force group that I was talking about, where we can have a more detailed conversation that's going to support the development of the brief. Like I said, there might be questions here that don't fully get answered during the webinar, but if you raise a question, we will be taking those questions forward to the task force group for more discussion. I would like to encourage you to join the task force. You can access it on the global platform. And it's going to be really important for us in the task force to hear from lots of different people. So please do share the information and join the group if you're interested. So moving on to today's webinar. Today we're going to be considering the needs of children coming into foster care and therefore how we identify foster carers based on those needs. We're going to be joined, we have some wonderful presentations from Maria Herczog, a Senior Policy Analyst for the Institute for Human Services, Claudia Cabral, Executive Director of the Brazilian Association for TDH, Vidivi Karangwa, who's the Deputy Country Director, Hope and Homes for Children in Rwanda, and Thomas Niyonzima, a foster carer and adoptive parent in Rwanda. So the purpose of the webinars is to share experiences and practice. We're not hoping to provide a solution or one model or approach to care, but to hear from a range of people from different contexts. So just to acknowledge that each presenter will be speaking from their own experience and context, and the same with the language used to talk about foster care. That will be individual to the presenter and the context in which they're from. So, moving on to our first presenter, I want to introduce Dr. Maria Herczog. Maria is an economist, sociologist, author, speaker, and senior lecturer who has been researching and teaching for over 30 years. She's currently a team leading expert of a child's rights implementation project funded by the EU in Turkey and works as a senior policy analyst at the Institute for Human Services in Ohio. Maria was a founding member and past president of Your Child and is president of the executive committee of the Child Rights Connect. Thank you very much, Maria, and over to you.
Thanks a lot, Louise. And I very warmly welcome everybody. I will try to talk in the broadest and most general context about the identification of foster carers. And as we have very limited time, I also want to encourage you to come together more often and discuss it in more details, because we need that definitely to support foster care. The summary of my presentation would cover the history of foster care around the world, just referring to the diversity issues in this regard, the cultural differences, traditions, and practices. The question whether it is valued, undervalued, or not valued at all to devote your life to children as parents, foster carers, or adoptive parents, in our case now foster care. The fast changing and growing expectations from foster parents, foster carers, resource families, the specific needs of children with special needs, and the changing models and practices of the care provisions. And very briefly, I will talk about a study we have done a couple of years ago in the so-called Visceral Countries, including the Czech Republic, Hungary, Poland, and Slovakia. Next, please. I just want to very briefly refer to the fact that if you look at the history of foster care around the world, there are many, many different forms of support. Obviously, the most common form is still the informal kinship care around the world. However, foster care has got also quite a long history, but interestingly enough, there hasn't been much studies or description made on the different developments in the different countries around the world. And therefore, oftentimes we are bumping into the problem when people want to reform their child protection, child care, child welfare system, that they think that adaptation of other good or promising practices could be easily done, although obviously the history and the situation in a given country is determining the opportunities for these adaptation opportunities. Now, obviously, in many countries, foster care hasn't been differentiated properly from kinship care. And there are countries, as you will see later in my presentation, where there are still some lacking clarity on what is the difference or what are the similarities and how could we decide which form to be used, especially when kinship carers, and we won't talk about it today, when kinship carers would also need the same type of support like foster carers, and also they would need some kind of supervision and preparation and in-service training. As far as the recruitment, the registration, assessment, pre-service and in-service training, supervision and support, again, it varies widely throughout the world. So there is, as Louise has said, we don't want to talk about one specific model or suggesting anything. I just want to draw your attention to the fact that it would be extremely important to look at these differences and similarities and understanding a little bit more the culture and the tradition, what I will talk about in the next slide. If you look at the differences of the different cultures, it's also depending very much on the religious traditions and family and community traditions, whether foster care is accepted, whether it is supported, or whether it is opposed based on the cultural beliefs. For instance, the idea of in many societies where the family ties are very, very close and very important. However, it is hard or not even allowed to place a child into a family who doesn't belong there, who is not a blood relative. In other cases, there are a lot of suspicions about child abuse and exploitation of children. So what I try to say is that the cultural differences, traditions, determining also some of the practices and especially policies, of course. Also, we have to be clear that during the last couple of decades, the deinstitutionalization efforts has had a very important effect on foster care, which has become dominant in many countries where previously institutionalization of children was much more typical, or it was the mainstream placement option for children. It is also hard from a cultural or traditional perspective to look at the life-changing decision that is made when someone is becoming a foster parent or foster carer. And I will talk a little bit more about it also later. As far as the suitability conditions are concerned, this is also a fast-changing kind of approach, when the question is whether how are we making a decision on who is suitable for this very, very demanding role to be a foster carer, and what are the different conditions to decide the suitability of those who are applying for this opportunity. Next one. As I said, I find it extremely exciting that the lifestyle patterns has changed substantially during the last couple of decades. So the question is whether the community, whether the organizations, and whether the families themselves are valuing the fact that someone is devoting his or her life to children, and to children who are someone else, children, taking care of children who need a family, nurturing family support. We also see that the role of foster care is often undervalued. It doesn't seem to be valued highly. The respect of foster carers in many countries is not very high. And there is always this suspicion that they are either doing it for only for money, so to say, or just because they want to exploit or abuse children. However, we also know that based on the research and experience, most of the foster parents have a very strong motivation because they love children. They feel that this is the skill they've got because they could successfully raising their own children, or there are some other motivations like they don't have children, but they don't want or cannot adopt, and they decide that foster care is something that can fulfill their desire to help children, or just because it is a situation where they are meeting a family or a child who needs support, and that's why they take care. On the other hand, there has been a lot of debates on whether the foster carers should be professionalized and be much more professionals, especially because there are more and more demands for children with very complex needs. And also because our expectations from the foster carers to take good enough care of the children has also enormously increased during the last couple of decades. It is also a question, how does the broader community, the family members, how are they reacting, and how are they valuing or not valuing the decision made by the foster carers? And this is oftentimes an important question for the prospective foster carers, whether they should devote their life to children or not. Next slide, please. As I was mentioning, we can see fast changing and growing expectations towards the foster parents, foster carers. It is obvious by now, what was not always the case, that they have to be assessed very, very carefully. There are a lot of conditions they have to meet, and a lot of preparation, pre-service training, in-service training, supervision is provided in more and more countries. Also, because of the different forms of care, one of the issues that has to be confronted by the foster care is that what we are aiming is that foster care is a temporary care of the children, meaning also that if it's the best interest of the child, then they should have regular contact with their family of origin. It is causing a lot of difficulty for many foster carers. So this is one of the questions before they are deciding to take care of a child, whether they can accept the family of origin and can meet them regularly, and also enabling the child and encouraging the child to have regular contact. Also, the developmental needs of the children varies widely, and there are a lot of children, as I mentioned, with very complex needs, and their care has to be also fulfilling, meaning that the foster carers have to be prepared for that. Also, we are expecting the foster carers to ensure that children have access to adequate health care and education, meaning that for many foster carers, because of the lack of community support, the lack of local services, it is not possible to take care of children because they cannot be placed into their care if there are no backup services also supporting the child and themselves. A relatively new expectation is the trauma-informed care, meaning that most of the children coming into care, or almost all of them, have been traumatized in one way or the other, and the foster carers have to be aware of this fact, and also they have to accept that sometimes the children's very challenging behavior is closely related to the trauma they've been through, and they have to be also prepared to handle these very, very complex situations. Next one, please. As we can see around the world, not only the history is diverse, but also the different forms and policies concerning foster care are very, very colorful. And of course, it differs country by country or region by region, but it is clear that there are very substantial changes. And when someone decides to become a foster care, they also have to consider these kind of possibilities. and different models. There are most of the foster carers are still volunteers who are not working. They are working, of course, a lot every day with the children, but they are not working out of the home. But they are full-time foster carers. There are foster carers who are taking care of children, but at the same time they have another profession. They are also working outside of the home, and more frequently, professionalization of foster care is also happening. For instance, therapeutic foster carers who are taking care of children with very, very complex needs, with multiple disabilities and so on. They are formally also employed. But in Eastern Europe, for instance, where traditionally there has been two-income families, most of the countries now are also employing foster carers, because this is the only way to recruit foster parents who otherwise should work somewhere else. So this is becoming a kind of profession. Also, this is obviously having an impact on the employment options, whether they have health insurance, whether they have pension, whether they have any kind of leave provisions, and so on. This is also obviously challenging for many foster carers, who have to decide which format is suitable for them and which is the opportunity concerning the organization or the country where they want to be working or want to do this activity. There are several organizational differences also. In most countries, civil society and non-profit organizations are dominating the area. However, it is quite scary that the for-profit enterprises and services are also on the rise, with many very controversial outcomes. Obviously, this is something, together with all the other ones, that would be important to discuss about in another at another meeting. When it comes to the different types of foster care, again, for the prospective foster carers have to decide whether they want to be want to specialize in caring for children. There are emergency, short-term, long-term, therapeutic foster care formats. This is also something that has to be decided by those who are applying or who want to become foster carers, because obviously it's not suitable for everyone to do all kind of care. For some people, it is really hard to accept the emergency care when children are spending a couple of days or maximum a month with them. For others, long-term or therapeutic foster care is not an option because of their family circumstances or just because they don't feel that this is something for them. The next one, please. As we are also focusing on children with special needs when it comes to the motivation and identification of foster carers, obviously there are very many different special needs, from serious chronic medical conditions to emotional disturbance, behavioral issues, physical disability, mental health issues. The question is whether the prospective foster carers are willing and are capable taking care of children with special needs. And there are many other issues, as I mentioned: severely abused children, for instance, traumatized, refugee kids, kids with very complex family situations, multiple sibling groups, and so on and so on. This is also something that needs to be very carefully assessed, and the professionals have to support the prospective applicant and the applicants to identify the capacities and also the willingness of the foster carers. Next one. We have conducted a study in the 4 so-called Visceral countries, in the Czech Republic, Hungary, Poland, and Slovakia. We were interviewing 50 foster carers in each of these countries. We were looking at the main motivation, which is clearly the love of children and a kind of desire to help those who are in need. On the other hand, though, it was quite clear that there are very different perceptions on the role of and place of foster care. For instance, oftentimes what we could see that those who cannot adopt because of the long waiting lists, or because they are older, or for other reasons they were not provided with the opportunity to adopt a child, want to be foster carers. On the other hand, it is also hard for many foster carers to accept in these countries the need for the regular contact with the foster families, and also with the families of origin, I'm sorry. Also, there is a lack of clarity oftentimes between kinship care, foster care, and adoption. And there are so-called hybrid formats. Oftentimes, kinship carers are becoming foster carers in cases, for instance, when the local policy are not making it possible to become a kinship carer, or when, for instance, they don't have any kind of support system, preparation, or financial support for the child. In these cases, even kinship carers can become foster carers. And there are also differences in the 4 countries where foster care is allowed to adopt the child in their care. In many countries, like in the US, UK, they are encouraging foster parents to adopt. In Eastern Europe, it seems to be the opposite. They are clearly separating the 2 systems, primarily because they want to avoid that people are becoming foster carers just because they would like to adopt, and a kind of shortcut could be done through this way. Identification of foster carers is getting harder and harder in these countries, just like around the world, just because of all the reasons I have tried to describe previously, especially because the lifestyle has changed, and devoting a child to a life to children with very, very troubled background and a lot of difficulties is becoming sadly less and less popular. So this is hard to find the foster carers. I also have to say that there are a growing number of people based also in this study who are applying because where they live in remote, underdeveloped or poor areas, they are applying to become foster carers because there are no other employment opportunities. And obviously, if they are suitable for this activity, it's fine. But if this is the only motivation, then obviously they have to be rejected. What is clearly very complicated in the 4 countries is to place children with special needs, with disabilities, and Roma children into the foster families because of the stereotyping and prejudice and the lack of services for the children, or the lack of acceptance of the local community, the schools, or the healthcare providers. When it comes to the financial implications, it is clear that Roma or the foster parents are accepting and actually also expecting, besides the allowance of for the children, some kind of financial support, especially because it has become extremely expensive. For instance, to transportation of the children, access to healthcare, or even education. And oftentimes they are spending their own money, just like in the case of their biological children. And they are also becoming poorer than before becoming foster parents. So these were the outcomes of the study. And I guess it would be important and interesting to also make such kind of research in other countries to understand better why is it harder and harder to identify and recruit foster carers, despite of the efforts of the deinstitutionalization, closure of institution, and provision of family and community-based care for children. Thank you very much for your attention.
Thank you so much, Maria. It's very interesting. Thank you. I'm now going to hand over to Claudia Cabral. Claudia is a psychologist specializing in family therapy and is the founder of the Brazilian Network Movement on Alternative Care, and the founder and executive director of the localized Brazilian association TDH. Claudia is a member of Family for Every Child Alliance and a consultant for UNICEF and Geneva, Switzerland International Social Service. Thank you, Claudia.
Thank you, Louise. Thank you very much. Thank you, everybody. Welcome to everybody. I'm going to present to you our experience in Brazil. It's a different context, and I think we will fit well on all the diversity of reflection that Maria has just raised now. So we can go for the next slides, please. I'm first just showing you the situation where we are in terms of implementing foster care. So Brazil changed laws very quickly to put in place our Brazilian guidelines. So since 2006, we have been discussing how to put within the law the perspective of raising foster care more than institutional care. So this slide is just to show you how long our laws have been was changed and the way we have been trying to implement and grow up the foster care instead of institutional care or residential care. The next, please. We have had a big difference in terms of ending large institutions and reforming our care system. In 2003, we estimate we had 80,000 children living in institutions in Brazil because of a sample study in 20% of the children in institutional care. It was almost 20,000 children on this sample. And after more than 15 years, now we raised in 19, I will show you a lot of numbers from 2019, but we need to think that it was the COVID situation. So we will discuss about it too, but we raised 31 76 to 9 children living in residential care, and we had only 1,377 children living in foster care. So you can see that we have much less children out of home accessing the welfare system and the care system, but the difference between foster families and foster care programs and the residential care program is still a big one. This is our challenging, and nowadays Brazil is investing a lot in grow this number of foster families in comparison with the residential care. Please. Which kind of cases we are facing? We are facing more violence against children, any kind of violence against children, abandon, abuse, neglect, physical violence, psychological violence. These are the cases of children that often judges and the tutelar council says they need to get out from family of origin. They cannot still live in with them. So this is the kind of cases we are looking for. And we finally work and find families and look for families to face this kind of problems, violence against children. Please. In terms of Brazil, everybody knows that Brazil is enormous. What have we done? In 2005, The plan, the national plan, that is our national guidelines on alternative care, was written in a very participative way, with a lot of participation between civil society, NGOs, and the welfare system, the government, and also the child, the child rights system. Everybody together was writing the national guidelines, and we raised the group that was the beginning of a big national network that is still is very strong on our content. And we have done, this is just for you as an example on how we think in Brazil, and it was very good to have a conceptual alignment on what do we want by foster care? What's the difference between foster care, kinship care, and adoption? What do we want to understand from the south to the north of Brazil as the most important service for the needs of the problems we have and the children are facing? So for 5 years, we have been all along the country doing a lot of seminars and workshops to raise this conceptual alignment. And on the next slides, I will show you the content of the conceptual alignment, please. First of all is prevention. We are always talking about prevention. We are always trying to raise the importance of community living, empowering local leaders to prevent raising violence within families. We always try to raise and to talk with the policies, the local policies, with the local municipalities, how to reinforce the role of family of origin. And also we consider that kinship care is on the family of origin, and we must before reinforce the role of the whole family. So we aligned a lot in terms of having an overview within the original family, the family of origin, and a kind of genogram for us to see everybody that could be looking for the child and preventing the violence and reinforcing the community. So it's an exception to say that the child needs to get out from the family of origin. But when the child needs to get out, the first option would be foster care. But which kind of foster care? So I raised here 3 points. One is prioritizing what we say that's the medium-term foster care. And for Brazil, on the law, it's written that a child, a temporary care, should be nearby 1.5 years. After 1.5 years being on the care system, the judges say, stop, study, and say, is it better to come back to the family of origin or to go to an adoption? Because the child cannot be the whole life living in a temporary situation. Long term is a need, but it needs to be an exception. Exception is 10–15%. So we will consider, and we consider long-term foster care. More for those adolescents who have been on the residential care system for a long time. So this is what we are looking for families that can care for these adolescents, and it will be normally in a long-term way, but always in contact with the family of origin. So it's a special approach. And prioritize, always prioritize the reintegration to original family, to family of origin, and not to adoption, because adoption is another program. Of course, there is still a lot of foster care cases that goes to the adoption, but we are attentive And we want to understand what is this kind of option. And residential care, we still have residential care. The law says that it needs to have 25 children maximum, but we are always looking for a distinct modalities for us to be able to study the case by case and decide for this child, is it better a foster care or not? Even if the law says that foster care is the first option, sometimes perhaps it's not. So the individual approach for an enormous range of problems is the challenging we have. The other one, please. So when we see the situation in 1920, always considering the COVID situation, because within the COVID situation, we had less children getting into institutional care. And some children within the institutional care, the residential care, going to live with new foster families that they had contact, that could be mother-in-law or an employee of the institutional care, because of the contacts and the need in lowering the number, getting low the number of lives being living in very big groups. So we had, for residential care, we had 2,000, almost 3,000 residential cares and 400 foster care services. So the difference was 13% between the services. It is still needing to grow. And this is why our government nowadays is really doing a lot of efforts to grow foster care. If we see below, we had 6%, almost 7% of children in foster care, comparing to those out of family of origin living. So the difference between 19 and 20, you can see that we had a number of children in foster care growing 22%. A number of foster carers selected 73%. The number of foster care services grows 13%. And the residential care number was lower, just almost nothing. So this is to show you that how are we organizing ourselves to find families and to select families, and the motivations that I'm going to say now on the next slide. The first thing, look for foster careers. It's not been difficult to find new foster careers, because we are doing a lot of efforts. The example from the others who are already foster careers is very important for the new one. So media, events, meetings, media and events at the very, very local level, with all the examples we have here, TV, social medias, municipality sites. And this is the government. The federal government is demanding all the municipalities we have, and we have more than 5,500 municipalities in Brazil. They are demanding everybody to raise this kind of service instead of residential care. So even if there is still the desire to the reform of the residential care and still have residential care, but the very, very smaller municipalities, they could have foster care careers. So it has been a big applying for them to raise new foster careers. So a lot of local events, outdoors, in public places, parties in the city. And if we had a change in 13% of the municipalities raising new programs, nowadays, I think it's a really very, very bigger number. One of the challenges, and the big challenging, we are facing is the meeting between strategic partners. The justice service needs to be together with the municipality and the welfare system to put in place foster care. And then on the other slides, I will explain better. Our way of working on foster care is, first, we have the child with a need, the children needing protection. And we have the tutelar council that is elected from the society to overview the needs of child within a region, receives the announcement, they know that children are in bad situation and needs to get out of the family of origin, but the court needs to get into the decision. And so judges and the team that work with the justice system needs to accept foster care and want foster care. The welfare system service, with the whole number of NGOs that are being very strong on this content, has already discussed it a lot on the national movement, as I said to you, the big network we created. But the justice system, not enough. And all that Maria raised in terms of doubts in terms of attachment, and doubt in terms of security, and doubts in terms of doesn't matter what they are raising. And so even if a municipality wants to open a new service, they face problems with judges. So we are really very close to the justice system to try to think and to reflect with them and the tutelar council what are the benefits of the foster care program. The other one, please. One of the things that raises questions, but it's really a very important need, is the fund support, the subsidy. The federal government is trying to implement a law on it, but there is a financial subsidy in the form of the law, and the local parameters and the family receives. It's not unemployment at all. This fund is for the child and for the needs of the child and more for the adolescents. And there are differentiated financial subsidies for the reception of a child or an adolescent with disability and things like that. So this is a kind of discussion and reflection, and a very important point for us to reflect with the families, because they are here not to achieve or to receive subsidy, but to take care of the child. So the foster care as a first placement for young children is being very demanded, and also the foster care after residential care for adolescents, as I said, that can be a kind of long-term foster care. The next, please.
Just a couple of minutes left, Claudia. Thanks.
Okay, I will run. So we have the selection process. On our selection process, we have a first interview to understand the first motivations that need to fit on the next 2 slides I will present till the end. We always do home visits and interviews, and a minimum 4 contacts with the whole foster family. We prepare them in a course. There are some municipalities with 10 hours course, but almost a lot of them with 20 hours course. It could be more, we will talk about it. And we have a foster families group monthly. So when the family has already passed by all the preparation and is waiting for a child, they can be in contact with other families once a month for them to keep their desire in receiving a family. The next, please. Some motivations we founded, and we found solidarity, desire in helping, previous informal experience with care in the family, loving child, wanting to have the home full, sometimes company for the young child. This needs to be discussed a little bit more, but it's genuine, it can be. Wanting to provide a child with the same care as they have received as a way of giving back to society and themselves. So a grateful person, always a kind of experience that they lived and they want to continue within the family. Full time after retirement, this happens a lot. Full time after retirement, closer to loving children and home full is something that happens. A part of religious belief. On the religious points, it's a good way of trying to find families, and desire to contribute to change society. So on the next and the final slides, I will show you when these motivations are raised, what do we look for us in terms of what we are, in terms of professionals looking for, and we would desire to prepare on the families that are demanding to be foster family. The first thing is emotional and rational balance between being a volunteer and a kind of professional. Availability, time, commitment with the day-by-day care. This third one is the point with the professional side, that's somehow interested in learning about children's rights and the history of the institutionalization in Brazil. Because one foster family receives not only the child, but the whole history of the child, and also the family of origin that the child brings within themselves. So this is important for them to think about. Open to respect and even include the original family on the process. This is one work that in our organization, ABTH Association, we do a lot, and it's very, very successful. Open to diversity, not to choose the child they want to. Of course, in terms of age, it can happen, but less they choose, open they are. So not intending to adopt. This is very important. There is another list and another program for adoption. And so this is something that we discuss with them. Perhaps sometimes it comes to an adoption, but not within the foster family program. The child can get out from the foster care program and so go to an adoptive family. And attachment and non-attachment skills. This is a very important point that we discuss a lot with these families. To be able to, with what they raise in terms of motivations, can be worked from us. And at the end, any family, any model can be candidate. No restriction in terms of simple person, divorced, remarried, gender diversity, or sexual orientation. We are very open in Brazil in this way. Thank you very much, and sorry for the time if I passed.
Thank you, Claudia. Thank you for such an interesting presentation. I'm going to move on to hand over to Vidivi Karangwa. Vidivi is the Deputy Country Director at Hope and Homes for Children in Rwanda, where she's been a key player in designing and implementing deinstitutionalization programs. She holds a master's degree in clinical psychology and has over 20 years of experience working with vulnerable children and families. She's a passionate advocate for care reform and has led many advocacy initiatives with government officials, academia, and faith-based organizations. I'm handing over to you. Thank you, Vidivi.
Thank you, Louise. Thank you to everyone. I'm happy to be with you today. I'm going to give my presentation on identification of foster care. And I will talk about how we identify them in Rwanda, in the context of Rwanda. And I'm going also to talk about their motivation to become foster care. And then I will talk about foster care for children with disabilities. So I find many similarities with other contexts like Brazil and other places. In Rwanda, when we talk about foster care, and the context of foster care start to be called like that with the deinstitutionalization program, because even before families we had the culture of fostering children, but in an informal way. And if we see the history of Rwanda, the first institution came in 59. This was our reflection when we started the deinstitutionalization program in Rwanda with the pilot, the first pilot closure, to think about how will we reintegrate children, the one who don't have families. It brings out the idea of thinking about before institution coming in Rwanda, how was families faced when a child is an orphan of all parents. And then we found that the first institution came in 59, and the other institution came after genocide, so that we found that families had the culture of welcoming children in their families, and it was like we had worries to say that after genocide it could be difficult to find families for those children. And at that time, because we started in 2010, in the country, it was a kind of initiative by the First Lady Office talking about foster Malaika Mulinzi, which is guardian angels. In the country, foster family, what we can call foster families, were identified, and they were like given award to encourage other families to do the same, to welcome children in their family. This was before child care reform. And when we started with the reintegration of children in the pilot closure, we thought it is necessary to see how this program of the Office of the First Lady work, if they can identify in the community a big number of families who welcomed children in their families in a spontaneous way. It means that we may find families with good willing to welcome children. It started by that. And with the initiative of the First Lady Office, other initiative came to say, the country had some slogan like treat every child as your own. All those slogans, Malaika Mulinzi, was to encourage people to be kind with children without families. The next slide, please. Next slide, please. So with that, the second, with that in mind, we said that it is possible to find families for those children. This is another. You have, this is the third one. May I have the second slide, please? Yes, when we started with the pilot and the childcare reform, knowing that in the community we have families with willing to receive children, we used, as in other places, awareness campaign through TV and radio spot so that people may know the childcare reform which is being done and be ready to even to be informed that there is a need of families, foster families, to welcome children. And the identification went through those awareness campaigns using churches, because as others said, through churches, we found many people with willing to welcome children in their families. And we used churches. We used also the channel of local leaders, because in Rwanda, you will find that everything we do in childcare reform, we are doing together with local authorities at all levels. So other way of identifying foster care families were into individual requests, where families hear through TV or radio, and they come to the sector office to ask for children to be fostered. And when it's come now for children with disabilities, it is really different. Through awareness, TV and radio show spot, you will not find families coming to ask for children to be with disabilities to be fostered. So we use the channel of some centers, daycare centers for children with disabilities, where you will talk with their parents, community volunteers, to found families for children with disabilities. Next slide. Next, please. For how we identified foster parent again for children with disabilities, it is also through parents with experience of caring children with disabilities. When a parent have a child with disabilities, his own or her own child, they are really very sensitive to people because of discrimination in the community or in families. They are best placed to know other families, other people ready to support children with disabilities. We use also the channel of parents with children with disabilities to help to identify others who can be good parents for children with disabilities. In Rwanda, the hotline is also used from the National Child Development Agency to the community. SMS messages are sent also to the community to explain about the need of foster families for children with disabilities. So when now to identify again families for children with disabilities, it is through the process when you have a list of foster care parents ready to willing to receive children. Through that session, because we have a different session, we have a preliminary session to explain about what will be their responsibilities. In Rwanda, you will find that when you sensitize people, you will have depending on the district where you are, sector where you are, you will have a long list of people ready to welcome children. This is done at the level of sector, and then they are putting there for a preliminary session to explain what will be the role, the responsibility of foster care, so that after that preliminary session. Now people will know what they want to do, if they want really to become foster family for children, and then they will complete an applicant form to request officially to become host. Through that session, again, we use to sensitize about children with disabilities, so that among those parents, you will find some ready to accept to become special foster parent for children with disabilities. But the number is really very, very few. When you want to have parents for children with disabilities. There is something other I didn't mention is foster parents. Sometimes they are just spontaneously found when you have a child abandoned somewhere in the community. Sometimes we found just families near the place the child is abandoned. The families are ready to welcome the child. Then after, they will go through the process to know if they are eligible or not. Next slide, please. Our experience in Rwanda, we found that through the churches, like I said, Muslim families were among the best one. We think it is among their how their church manage that, but we found very good families for children among Muslim families now. The next one.
Just a couple of minutes left, Vidivi.
And when we want to talk about the motivation to become foster care in Rwanda, it is not different from what our colleagues in Brazil say. It is the influence of the culture, people living in these families and seeing their parents doing the same, welcoming children with no any blood relation, and they're just reproducing the same. Others are influenced by foster families in the same area because of the child care reform and the closure of institutions in Rwanda. People are seeing families welcoming children, and they are influenced by others, and they will do the same. Other motivation is for Christian parents, saying that it is a belief or value, Christian one, to do a good thing, which is their motivation for Christian is among their beliefs and values. Other parents also are motivated because they lived the same experience of having other parents without any relationship, blood relationship, taking care of themselves, and then they decide to do the same when they become parents. We have also some cases of couples without, we didn't get a chance to have children, and they want to at that point, many of them want to become foster, but then after they become adoptive parents. Or case of searching another sex when they have only given birth to the same sex of children. And I didn't mention here, but we have also some motivation of like being supported. I didn't mention because when we found that they are not, they will not be identified like families, but we had some cases where when we sensitize people to become foster parents, you will find some families just wanted to become foster parents because they think that they will be supported This is why sometimes in Rwanda you will find people saying that foster families are just among poor families, because we found that cases where you go for identification with local authorities, and you will find people who are in need of support claiming to welcome children, because they think that if I have a child at my house, the government will support me. And when we found that motivation, well, they are not eligible. But for some cases, they will just hide their motivation, and they will be sometimes identified and selected among foster parents to welcome children. And because in Rwanda, the foster care is not paid, after time, you will find out their real motivation is just clear after. And for that, those cases are placed in other families. But there are not many, because they are often just identified during the preliminary session, because it is explained that when you are fostering a child, be sure that you will not be financially supported, because of you will not be paid. And then some directly decide to resign, to say that we are no longer willing to welcome children. Next slide, please.
Vidivi, just 1 more minute left.
Next, please. The next, because this is just the testimony. So I'll talk about the community engagement, because during this process, there are professionals working together to fund foster families, but the community is playing a very big role here. Without the community, it is difficult to be able. So there is another slide before this. Yeah. Yeah, I was saying that because of experience of closing institution in Rwanda for typical children with disabilities, the community is now aware, and they are aware of their role to be part of that and to welcome children, or to search for foster families, or to be the eyes of children when they are placed in families to prevent the abuse. So we work at different levels. In Rwanda, we will have the province level, the district level, sector and cell level, till the village level. All those levels are playing a role in the foster care identification, and even on matching. The next slide. Next, please. At the level of the district, you will have staff in charge of child protection. This is the family promotion officer, and the one at the level of in charge of children, protection of children. They are working with other people at the level of cell. Then you will go through the level of village, where we have what we call here in Rwanda, Izu, Inshuti z'umuryango. They are friends of families. All those people are, they are connected with that to identify families at the level of village, and then those who are identified are putting in the level of cell to be assessed by professionals to know if they are they're eligible. Then it is at the level of district where they are trained and selected to become really foster families. So the level of the community role is really very key here in Rwanda. When you use the different channels, church, community work, meeting, different meetings here we use to give the government, use different meetings to give information like what we call family evening, and we have a community work every last Saturday, and every year we have the International Day for People with Disabilities celebration. We use all those channels to have to give information and also to collect and to have families to become foster care. The next slide. The next slide, please. This is an example of community engagement. At left, we have the gender officer at district level talking to people. And at right, we have people in the International Day of People with Disabilities, when you took the opportunity to sensitize people. And here in the middle, it's just like an example of TV and radio show to explain about foster care and how to become foster care in the country. Next, please. Next slide. Also, yes. This is just an example again of a session where a foster care parent is engaging others to become foster, like herself. The next slide. Next, please. Yes, I was already starting to talk about children with disabilities, how we found foster families for them. Here we can say it is really not easy to find foster families for children with disabilities. Like I said, you will not find families just coming to ask to become foster families for children with disabilities. It's need to go to engage the one who are willing to become just foster, and then we explain that we have now in Rwanda, because most of institutions are now, for typical children, are now closed, we remain with only children in SOS villages. So when we talk with the list of, with the number of foster families ready to welcome children, we just say that the one in need of families now are children with disabilities. And then you will find just few number of people ready, but the good one, you will have a list of maybe 100 families or 50 families ready to welcome children. But when we talk about children with disabilities, you will not have more than 2 for every session. You take the 2, and then in another sector, you will have maybe 3 or 5. The foster care for children with disabilities, they are few, but when they are engaged, they really take their engagement, and they go through the whole process to become special foster care families for children with disabilities. Yes. The next slide.
I'm really sorry, Vidivi. I think we're going to have to move on because we're actually running out of time a little bit. Yeah. So I'm very sorry.
Just showing how here in Rwanda you will have since the beginning of child care reform, open house for children were involved in the placement like of 1,402 children in families. The 1,402, you will find only 285 in foster families. It means that the number of children in foster families is really few comparing with the other placed in in their own family or extended families or kinship care. We have, when you will identify or sensitize family to become foster care, we'll have a very big number, but now for them to become foster care, I may say they don't have the chance to have children to foster, because the big number is going in their own families. But we continue to identify and train, because sometimes you have breakdown in families and you are in need of foster family to accompany the child, or you will have abandoned children in need of foster care families. This is why the process continues to identify and assess and train foster families in Rwanda. This table is showing the example of only 2 institution pilot, one for children with disabilities here in Rwanda, because this is where we are now, piloting the closure of institution for children with disabilities. We closed the first one with 26 children, and the second is ongoing. Now we placed 21 children. We remain with 16 to be placed. The here is showing that amongst 26 placed from the first pilot closure of children with disabilities, we had only 5 in need of foster. All others.
Vidivi, I'm really sorry. I'm going to have to stop you now, because we're really running out of time and I do need to move on. We have one more speaker. So I'm really sorry to move on, but I'm going to have to stop you. Sorry about that.
It is the last one. It is the last. Thank you for your attention.
Thank you, Vidivi. Thank you for such an interesting presentation. I'm sorry to have to stop you. I'm sure everyone wants to carry on listening to you. It's very interesting what you're saying. But I'm just moving on to our last speaker now, who is Thomas Niyonzima. And Thomas is married and a parent of 5 children. He has a bachelor's degree and works as director of a secondary school. He and his wife went through the foster care process, and he's going to share with us his testimony today. So thank you, Thomas.
Thank you too. As you said, my name is Thomas Niyonzima. I am going to give you my testimonial. As you said, from my childhood, I was the ambition of fostering or adopting a child, but from my childhood, I grew in a family with little income, and my family in it there was a lot of challenges, problems of poverty. I grew in such a family. From that family, I was not able to pay myself the school fees, but with the support of God, I met a family in 2004 when I was in the senior 4 secondary school. That family helped me to pay the school fees, to feed me. That family gave me the food, and from there, I saw that that family was driven by love, and therefore, because of that kindness they showed me, it motivated me also, because I had the vision of adopting a child, and I decided on my own that while I will finish my studies, when I will get married, I decided to foster or to adopt a child. That was my vision. I finished the university in 2002, 2012, I began working. My job was a teaching job. While I had two little boys, we started together with my wife. I began to tell her what I have just decided before we get married. From that, I have been surprised that listening that even my wife had that idea before, because in her side, he grew in a bad condition, but very, very bad condition, and she has been supported by some people. You understand that at the time of a conversation, we had two little boys, and I was a teacher. My wife was jobless. We finished the university, but at that time, she didn't have a job. From that discussion, we take a decision ourselves without being sensitized by someone else to go to the district to ask how we can find a child to foster. That was our own thinking without being sensitized. I am summarizing. While we meet the district leader who is in charge of social affairs, he has been surprised seeing someone who come himself to the office, ask for a child to foster or to adopt. At that time, in my mind, I was thinking of adoption immediately. That person has been surprised, and he asked me many questions. Asked me the job that he asked me my job, asked me what my wife is doing. He asked me if I don't have other children. I told him that I have two other little boys. That person has been surprised, and he told me that he is not sure that I will be able to provide for that child what she will be needed. After our conversation, that person sent me to the NCC, National Commission for Children and Hope and Home for Children staffs. We sat together with them. They asked me many questions, and after this staff, they began to tell me that they are very happy to see someone who came himself without being sensitized, and after they begin at assessing me. They assess me, but at that time also, because I grow in the family, I have my brothers and sisters and I have parents. We sat together and I told them my idea that I'm going to adopt. That was my idea of adoption, to adopt another child. My parents was very, very happy, and my sisters and my brothers sat together. They asked me many questions. How did you think about that idea? Will you be able to adopt that child? How can you pay the school fees? How can you feed him? How can you be able to do some everything to that child, because they saw that my life was not good because of the job that I did at that time. But because I have been driven by love, I responded to them that God will help me. What they are waiting, my boy will eat, and that one also we set it together and we share the same food, and we share the same house. After the NCC and the Home for Children, we went together in the institution where the children lived. I began visiting the institution, and while I was reaching the institution, even the child visited me at the home. After they agree with me, after the many assessment and some meetings, we will be agreed together that I will be given a child. They give me a girl, and I wanted a girl because I have at that time I had two boys, but today I have 4 boys, and that girl I have 5 children. While they accepted to give me a child, I gather my relatives, my parents, my brothers, set together, and some of because I'm a singer in the church, I called also some members in the choir, in the church, set it together. While I received that child, we set it together, and we did a short ceremony of receiving that child at home. Now, I received that child in 2017. After 2 years of hosting, I have been agreed to begin the process of adoption. And in 2019, I entered in the court, and I have just adopted that child. Today, she is 14 years old. She is in primary 5. Life in my life have changed for good. She is very, very smart, and I feel like I have accomplished a dream and a promise to God. She's very, very happy. Now this is my testimonial, and after receiving that child, I sensitized also another person who has got a twins. From that time till now, I am together with my girl. She is studying, and we are happy in our family. Thank you very much. This is my testimonial. Thank you.
Thank you, Thomas. Thank you so much for sharing with us. It's great to hear from you. So I'm just going to wrap up now. I'm really sorry that we've gone a little bit over time. So thank you for those of you that have been able to stay with us. I hope you've really enjoyed the presentation. So thank you to everyone who has presented and participated today. It's been really informative and really interesting. If you do have further interest in talking about some of these subjects more, we have the task force on foster care that you can join on the Transforming Children's Care platform. We have a next group next Tuesday. Every Tuesday after the webinars, we're meeting to have a look at these practice areas in more detail. So really would encourage you to join. You'd be very welcome, and be great to see lots of people there. So thank you all for being here today. Thank you also to Catherine and Margot from Better Care Network for working so hard to put the webinar together, and also to Nora and Rosalia for interpreting for us today. And thank you all for attending, and hopefully we'll see you next time. Thank you. Bye.
Bye.
Thank you.